Millions of elderly and vulnerable people across the country are finding it particularly difficult to deal with the implications of the coronavirus. The government has suggested that all over 70s or people who are at risk start self-isolating. And what impact is the crisis having for people with disabilities? Well, joining us now is David Clarke, Director of Services from the Royal National Institute of Blind People. David, thank you very much for joining us here on BBC News. Tell us about the extra challenges that blind and partially sighted people are facing at the moment.
Well, I think some of the immediate challenges are things like stockpiling going on in the supermarkets. It's very, very challenging for blind and partially sighted people to get hold of the usual foodstuffs that they would use, or medicines or vital essentials. Blind and partially sighted people are big users of online delivery, and of course it's impossible to get a slot for 2 or 3 weeks. So we at the RNIB, in fact, we've been working hard with a number of charities across the sight loss sector all day, working on a number of initiatives, one of which of course is influencing the supermarkets to really help us out and deal with that issue. Of course, another issue is reductions in public transport. Blind and partially sighted people are very reliant on public transport to get around, so that could be another issue. And also, I think the issue of, the way that I personally, as a blind person, get around involves a lot of, touching and feeling. And I think there's an increased awareness that, of keeping your hands clean and following the instructions. But that's very challenging to do when one is out and about and trying to be mobile. So that's just a couple of the issues. I think the final issue I would raise is that, something like self-isolation isn't as easy for someone, a blind or partially sighted person, to do. And bear in mind that whilst blind and partially sighted people come from all sorts of different demographics and age groups, there is a very large proportion that are over the age of 70. And of course, these restrictions very much impair their ability to live the life they want to lead.
Tell us about the work that the RNIB is doing to help people.
Well, I think the first thing is we want everyone to know that we are very much open for business and we're here to help. We have our helpline, 0303 123 9999. That starts from 8 a.m. to 8 p.m, Monday to Friday, 9 a.m. to 1 p.m. Saturday. We are there not only to answer the normal questions we would ask around sort of information, advice and guidance about sight loss, but also to understand people who are feeling isolated, feeling lonely, feel like they need local support. And we're working very closely across the sector with a number of charities, both national and local, to provide that kind of support. We're also ramping up our support networks. We're launching a number of connecting opportunities across telephone and online to replace a lot of the face-to-face network that's had to fall away. And of course, we're really listening to people and asking what they want, because, this is a pretty new situation for all of us. And, we really do need the public support as much as ever at the moment, because we're really trying to understand our customers' needs and provide them what they need at this difficult time.
You say you want more public support. What does that mean? Donations?
Well, I think clearly donations are always useful because it enables us to do the work we want to do. But also, when you're setting up your local groups, when you're thinking about what's happening in your street, what's happening in your clubs, communities, societies, it would be really helpful is, like many other potentially vulnerable groups, that you stop to think about the specific impact that some of the things you're arranging or some of the activities you're organising might well have on blind and partially sighted people, and seek very much to help them in those circumstances. I've already mentioned things like shopping and getting about. Other things we're making sure we're doing is, Facebook groups, for example. We have a number of regional Facebook groups which we very much encourage people to join, who can find out lots of local information there. But also things like our talking book provision. We're ramping that up to give people more books at times of potential isolation and even potential loneliness, and also making sure that our online shop is properly stocked, so that people can get hold of the vital things such as canes and other equipment they need, when they're going to be spending more time at home. I think the final really important thing is about public information. We're working very hard with the public authorities to ensure that a lot of the information that's provided around the coronavirus is actually accessible. You'll see a lot of graphs, you'll see a lot of pictures, images. David? They don't compute. No,
indeed, they need interpreting, don't they? David Clarke from the RNIB, thank you very much for talking to us.
A pleasure.
Now, take a look at this.
Well done, Tom.